Hello everyone, my name is Ivy Liu. I'm one of the registered dietitian at the Toronto Western Hospital Bariatric Surgery Program. Welcome to the 1-month post-surgery class, vitamin mineral supplement module for SADI patients. For our SADI patients, you are likely already familiar with a regular vitamin mineral supplement schedule based on your previous experience with the sleep. As you recall, for the first 4 to 6 weeks after surgery, you want to take chewable forms of supplements as they are easier to get down in the first month after surgery. You should be able to find chewable options for multivitamin, calcium, vitamin D, and vitamin B12. However, some vitamins do not have a chewable option, namely the vitamin A, E, and K. So you will need to crush the tablets or open the gel capsules and mix it in yogurt or applesauce to take it. Alternatively, you can purchase ADEK multivitamins from US Bariatric Advantage or Celebrate sites. Let's start with the multivitamins. Remember, the dose of the multivitamin is 2 per day. Make sure you're taking a multivitamin with at least 18 milligrams of iron per pill. If you just started on a new bottle and unfortunately does not have 18 milligram, then you can consider adding a separate iron supplement. You can send us a message if you need help finding a right iron supplement. You would have received a multivitamin handout with a list of multivitamin products we found to meet the guidelines, so you can use this to help you make an appropriate purchase. Some examples are listed on the slide. Next is the calcium with vitamin D supplements. The total dosing you need is 1,500 to 1,800 milligrams of calcium citrate per day. Calcium citrate is preferred form for optimal absorption post-surgery. The tricky thing with calcium is that your body can only absorb about 500 to 600 milligrams at a time, so you need to spread out the doses of calcium throughout the day. You have also received a handout containing calcium citrate with vitamin D products that meet the guidelines, so use that to help you choose an appropriate option. Some examples are listed on the slide. Dosing will depend on which supplement you're taking because they all contain different amounts. The most popular is the Weber's Natural Calcium Citrate found at Costco. Since these pills are only 300 milligrams each, this means to get the required 1,500 milligrams, we should aim for 2 pills for the first dose, 2 pills for the second dose, and 1 pill for the last dose of the day. Each dose separated from one another by at least 2 hours, also at least 2 hours away from your multivitamin, as the iron in the multivitamin can interfere with calcium absorption. So it is important that we space these out. Also important to know that if you are a postmenopausal woman, your needs are higher. Here we should aim for 1,800 milligrams a day. Next, let's review vitamin B12. You will need 1,000 micrograms of B12 per day. Previously, we had you on a chewable dissolvable B12 dose of 1,000 micrograms. This is still okay to take. Some people do an injection once per month. You want to avoid B12 that are extended release or time release. This will be indicated by a clock icon on the supplement bottle. These are not absorbed well. For the vitamin A, D, E, and K, we are aiming for 10,000 units daily of vitamin A, 2,000 units a day of vitamin D, 400 units a day of vitamin E, and 300 micrograms a day of vitamin K. Alternatively, you can purchase the ADEK multivitamin from US Bariatric Advantage and Celebrate sites if you do not want to take them separately. Please refer to your SADI vitamins handout. This is a sample schedule for your supplements if you are taking the vitamin A, D, E, K separately. At breakfast, take the 2 prenatal multivitamins and 10,000 units of vitamin A and 1,000 microgram vitamin B12, or you can do vitamin B12 injections monthly. At snack time, take 500 to 600 milligrams of calcium citrate with 1,000 units of vitamin D. At lunch, take another 500 to 600 milligrams of calcium citrate with 1,000 units of vitamin D and 400 units of vitamin E. At dinner, take the final dose of calcium citrate and 300 microgram vitamin K. At bedtime, take iron as needed based on blood work. Remember to check in with your family doctor or pharmacist about potential interactions of these supplements with any medications you may be taking and modify your supplement schedule accordingly. This is the end of this module. I will see you in the next one.